Hi there, Sari. Welcome back to PT. We've been kind of having a few of our last treatments have been focused on decreasing a lot of this back pain that you've been having and getting you kind of moving again, right? So I just want to kind of touch on some of the reasons why we're going this route with physical therapy and why this pain probably hasn't decreased as much as you like to in the past. So first of all, I just like to explain kind of the role of the body in, especially with your back pain. But the role of the body, the position it plays when it picks up pain. So in your back, you have discs, right? They're all the way down your spinal column. You have discs that are aligned with your vertebrae. And so when you have a lot of pressure on a disc, or if you're kind of deviated one way or the other, you're going to push it one way or the other. But you're applying this pressure. It's like a constant pressure on the disc that initiates it brings about a mechanoreceptor response is what it's called. There's little receptors that kind of pick up the pressure, and that's what sends a signal up to your brain saying this isn't right, there's something abnormal, this is painful, and then your brain kind of sends it back down to that area, and that's where the pain symptoms come from. And so with your condition right now, this has been a chronic issue, and so your back is maybe if you look at your spine, there's going to be different abnormalities about it, but there's probably different spots of it that are out of place or just not in the right spot, and they've been this way for years. So it's just a chronic condition. And so with the look at the route that I want to take with you is to first decrease some of your overall body weights. Looking at your BMI, it's a little higher than where we probably want it, especially with like a healthy population in general. To decrease that pain or to decrease your weight a little bit is going to decrease the amount of pressure from a disc to the next disc, the next disc, the next disc, all the way down your spine. And so if we can eliminate some of that weight, some of that pressure pulling down on it, we can start eliminating some of that pain because there's not as much pressure, there's not as much input coming into your spine saying, "Oh, this isn't right. This is overwhelming for me," right? So that's the first thing. A second thing would be get you moving a little bit more. Okay, research has shown that the more you move, the more like positive chemicals are released into your bloodstream, into your brain, that say, "Oh, this movement, this motion in my muscles, it's working," and so that overall decreases your pain as well as with your spine mobility. We're going to start increasing your range of motion because you're pushing yourself into those ranges of motion, or the end ranges we say, into positions they haven't been before. And so over time, it's going to start stretching out, per se. And so an analogy I kind of like to give, or might work with you, is if well, first of all, does this make sense to you? Where I'm kind of going right now?
I mean, it does. It does.
Okay, perfect. And please feel free to stop me at any time,
Okay.
and we'll kind of address whatever. But if you think of yourself in a cubicle at work, at your accounting firm, you have all these cubicles with an individual. They have all this space to kind of not probably not that much, but they have enough space to do their job, right? Now, if you take all of your employees or all of your coworkers at your job, you put you all at one big round table or one big square desk, and you have no room, for your elbows. You have no room to move around. You're essentially elbow to elbow. Now, over the course of a day, you're going to be getting finicky. You're going to be getting, anxious, agitated with your coworkers, simply because there's no room, to move around. And so that's kind of like the way that your spine is. If you think of a disc, if you have all this pressure kind of moving on it, pushing on it all day long, it's going to be agitated. So I'm assuming at the end of your day, your pain is probably the worst. Is that
Yep.
correct? Okay. And so it's kind of the same concept, right? Now moving forward, then I've pulled out a few articles to kind of explain a little bit of what I'm saying, just to put some research with the madness, say. One article here from the journal Pain found that just a 10% reduction in body weights decreased pain not only within the joint being tested, or the body part that was most painful, but across the body we've seen widespread decrease in pain, which is pretty significant. And 10% body weight might even just be in the first 2 weeks or something, losing that much water weight, which will progressively turn into fat. So pretty reassuring with that article. And then another one here It's a study by the Medicine and Science in Sports and Exercise tested pain tolerance with exercise for 6 weeks among two groups of individuals. One group did not do any exercise at all. They just had the first initial pain assessment where they had a blood pressure cuff and just essentially took as much squeezing as they could tolerate. At the end of 6 weeks, that group did not improve their pain at all. It stayed the same. But they took a group with another group that performed 6 weeks of aerobic training, so a lot of biking, a lot of running, things like that, and did the same study with those guys, or those people, and they found a significant reduction in pain tolerance. So they could apply far more pressure than they could in the beginning. So it's just kind of alluding to kind of what we were talking about earlier, just kind of restating that, and more of a physiological or more of a cell look at it. Cells within your body. When you work out, your brain releases a natural opiate. I'm sure you've heard of opioids, maybe, like the drugs. Your body has a way of producing natural painkillers, which are far stronger than what you could receive over the counter or even from a doctor's prescription. But your body releases those with exercise. And so as you exercise more and more and more, you start releasing more of these opioids into your system, which will overall decrease your pain. And like I said, the more you work out, the more likely your cells are going to be able to produce them moving on further down the road. So I guess I've talked enough now, but I want to hear from you. Is there anything in your life that you've been struggling with? Things that maybe cause more pain than others, things that you just wish you could do that you used to be able to that you're not able to anymore?
I really enjoyed golfing.
Golfing,
but
okay.
It's hard to swing. It's hard to sit in a golf cart.
Mm-hmm.
The bumps, and I'm starting to get grandkids, and it's hard to sit and it's hard. I can't bend over to pick them up.
Okay. Perfect. So those are two examples of just daily activities that we take for granted. When we're younger, when we're agile and just hopping around. But moving forward with our exercises here then, that's where I kind of want to start. So you said golfing, bending over to play with your grandchildren. We'll start with simple activities such as those, just getting you into those motions, and I'll be there as a guide to kind of help you to see if your posture is kind of out of line, but to make sure you're doing it correctly in a way that facilitates proper movement. Okay, so once we establish proper movement, we can progress to adding resistance, to putting making a quicker movements, I guess. Like if you're doing a golf swing, we want to just start slowly progressing to full swing. So we're gonna start from there and just progressively beat into the more intense activities that you would like to start working on. Okay, so without further ado, we can go ahead and get started with some of these exercises just to see where your mobility is at, okay?
Sounds great.
Any other questions?
Nope.
All right, perfect.